Once we have checked for breathing and established normal breathing is not present, we should call for help. You should take the baby or a small child with you to call for the emergency services. If help is available, then we would send our bystander to call for help as soon as possible and then start basic life support. Basic life support for a baby is to give 5 initial rescue breaths and then apply 30 chest compressions followed by 2 further rescue breaths, repeating the cycle of 30 compressions to 2 breaths in the same manner as for an adult. As mentioned, the depth of the compression should be 1/3 of the chest depth. So if you identify an adult casualty as not breathing normally, then you should waste no time and start chest compressions and start your basic life support. If you're on your own and you have to leave the casualty to call the emergency services, then there's some considerations you have when returning to the casualty. Remember to recheck for any dangers, but again, do not waste any time and start your basic life support as soon as possible. In terms of your primary assessment, remember we said you should be looking and checking for signs of normal breathing. What can I feel? What can I hear? What can I see in terms of chest movement? But we should also be looking for things like agonal gasps. And remember, agonal gasps are not normal breathing, but they are present in up to 40% of cardiac arrest victims. Agonal gasps occur commonly in the first few minutes after sudden cardiac arrest. They are also an indication for starting CPR immediately and should not be confused with normal breathing. You should also at this point be aware of the reasons why it may be that you're not able to give effective or successful rescue breaths. And they could include that the airway is not open sufficiently with enough head tilt or chin lift. You may not have the correct seal around the casualty's mouth or nose, or the mouth or nose is not closed correctly. It could be that there's an obstruction. If there's a complete blockage of the airway, it's important that you can identify these, because at the end of the day, if 2 effective rescue breaths have not been effective, then you should just continue to move on to your chest compressions and then consider these when you come back to give further breaths. So if you're unwilling to give rescue breaths, what I would ask you to consider is you continue with chest-only compression CPR. You may not always be able to, or it may not be best to provide mouth-to-mouth resuscitation. So just to think about a couple of other things, other methods you could include are mouth-to-nose, mouth-to-neck breather, so also known as a stoma, or it may be that you're using face shields or a pocket mask for protection or ease of application. Again, let's just recap on the main points of basic life support. So main points are the correct alignment and placement of our hands in the centre of the chest, the correct depth of 5 to 6 centimetres, and the speed of our compressions of about 100 to 120 compressions per minute. The correct ratio of compressions to breaths, 30 compressions to 2 breaths, and now starting with the compressions, and to continue your CPR or basic life support until help arrives, the casualty recovers, or you become too exhausted. I do get the question quite often, is if I'm one of multiple first aiders that are trained to give basic life support, can we actually share basic life support and reduce the fatigue? Yes, you can, but my recommendation would be that you change over with minimal delay between compressions, and actually don't actually share, i.e. one breathing, one compressions, because you may become tired at the same time. So actually just hand over the full CPR at an appropriate point. As we said, if for any reason rescue breaths cannot be given, then chest-only compression should be administered to circulate the oxygenated blood that's still in the body. And one of the things to now think about with CPR is that if a defibrillator is available, then this should be made available ASAP for someone trained or for the medical emergency services to use when applicable.
Shock is a life-threatening condition and occurs when the blood flow to vital organs is critically reduced and deprives the organ of oxygen. It is simply described as the lack of oxygenated blood to the body's vital organs. Major causes of shock include heart attack, severe blood loss from uncontrolled internal or external bleeding, and also conditions known as dehydration, severe infection, poisons, persistent vomiting and diarrhea. The recognition, signs and symptoms: a rapid, weak pulse, pale, blue-grey, cold, clammy skin, nausea and thirst, rapid, shallow breathing, unconsciousness. Let's now look at the treatment.
First of all, it is important to treat the cause, whether that is a bleed, a burn or an injury. If the injuries allow, lay the casualty down and then raise and support their legs. This action will help keep the blood at the body's vital organs. Be aware of injuries such as a spinal injury or an injury to the legs. So if, for example, a casualty has a fracture to one leg, then to treat for medical shock, you should raise simply the other leg. You should loosen tight clothing and keep the casualty warm with items such as blankets or coats, but ensure that you insulate any cold ground. Call 999, calm and reassure your casualty, whilst monitoring the airway and breathing at all times. If the casualty becomes unresponsive and unconscious and is not breathing normally, then you should carry out the procedure for basic life support.
So, in summary, shock is life-threatening. Don't forget to treat for shock when managing more obvious injuries. Lay the casualty down and raise their legs if injuries allow. Dial 999. A heart attack is most commonly caused by a sudden obstruction of the oxygenated blood supply to part of the heart muscle, such as when there is a blockage in one of the coronary arteries. If the heart does not receive oxygenated blood, part of the heart muscle will die and impact on its ability to function properly. There is real risk that the heart will stop beating. The severity of the attack will depend on where the blockage occurs. Many people who die after having a heart attack could be saved if someone recognised the early warning signs and called for professional help as soon as possible. The recognition, signs and symptoms. Central vice-like chest pain. Possible pain down left arm or in jaw. Breathlessness. A rapid or irregular pulse. Rapid breathing and a shortness of breath. Pale blue-grey cold and clammy skin. Nausea and vomiting. Sense of doom. Let's now look at the treatment.
As you come to the initial assistance of your casualty, you should assist the casualty to rest and reduce the pressure on the heart. The ideal position for a casualty suffering from a heart attack is known as the half-sitting position or the W position. You should support the casualty to the floor, bend their knees and support their head and back. If available, place something underneath their knees to support them in this W position. You should monitor the casualty's airway and breathing at all times and loosen any clothing. Calm and reassure the casualty and call 999 for an ambulance as soon as possible. If the casualty becomes unresponsive and unconscious and is not breathing normally, then you should carry out basic life support procedures.
So, in summary, often confused with indigestion, but never again. Take action as every minute counts. Reduce pressure on the heart. Dial 999. Be prepared to provide basic life support. You can administer aspirin if you are sure your casualty is not allergic. Any doubt, do not administer. This condition is a severe allergic reaction that may develop within seconds of the casualty being in contact with the trigger factor. The body reacts to the trigger by producing large amounts of histamine. It is usual that this can lead to the swelling around the face, mouth and airway, when breathing is then usually impaired. The most common triggers are nut allergies, dairy, shellfish, stings, and some drugs. The recognition, signs and symptoms. Anxiety, red, blotchy skin, swelling of the face and neck, a fast pulse, swelling of the mouth and tongue with puffy eyes. Let's now look at the treatment.
If you have discovered your casualty is suffering from a severe allergic reaction, i.e. anaphylactic shock, then you should act quickly due to the risk of an impaired airway. If your casualty is conscious, you should sit them up into a comfortable position and support them. You should then encourage the casualty to use their own medication. Their medication is usually adrenaline in the format of an EpiPen. You should be prepared to open the airway and resuscitate if required, and monitor the casualty's airway and breathing at all times. Do not hesitate to call 999 for an ambulance if you feel the airway is still restricted or the medication has not worked. It is recommended that even if the casualty appears to recover after the application of their medication, that you should refer them to hospital for further examination.
So, in summary, a very serious allergic reaction. Immediate emergency treatment is required. Medication is an EpiPen containing adrenaline.
Medical shock is the insufficient supply of the oxygenated blood to the body's vital organs. Remember, the signs and symptoms of medical shock are rapid, weak pulse, pale, cold, clammy skin, nausea or sickness, fast and shallow breathing, and thirsty. Looking at those in a little bit more detail, a rapid pulse as the body produces adrenaline to speed up the heart and help circulate what blood is left, but it's weak because there's less of it. Fast breathings as a result of the blood going faster through the lungs. The casualty is likely to be pale because of the reduced amount of blood that's been delivered to those body's vital organs. And the skin is clammy as the skin sweats. There's no heat for it to evaporate. I think we really have to highlight that medical shock is serious and treatment should be given if suspected. Medical shock can be brought on by a number of circumstances, and those include the severe loss of blood from internal or external bleeding. That can be also a loss of bodily fluid due to burns or excessive vomiting, or something like diarrhea. Hypovolemic shock. There's also the reduced blood supply. That may be due to the activity of the heart, such as a heart attack or a coronary thrombosis. That's known as cardiogenic shock. Then you've got toxic shock, and a toxic shock is the widespread dilation of the veins with insufficient blood to fill them. This can be brought on by bacteria or chemical toxins. There's injury to the spinal cord or severe head trauma that damages those nerves, controlling the circulation and changes the blood pressure. That's known as neurogenic shock. And then there's the emotional shock. This is the overstimulation of the vagus nerve, which can be caused by pain, fright, or even emotional distress, which, with this type of shock, the blood pressure is lowered, the pulse rate will then be slow, as it is with fainting. As we said, anaphylactic shock is a severe allergic reaction causing the body to produce large quantities of histamine. This can lead to swelling of the airways, circulatory collapse, and heart failure, which you need to be aware of. Has anybody experienced an anaphylactic shock? Those that have will tell you that the reaction can be very quick after exposure to what they call the allergic trigger. So to treat a casualty with an anaphylactic shock, you should call for an ambulance immediately. If the casualty has a breathing difficulty, help them sit up into a comfortable sitting position. If they are unconscious, check that the airway is open and clear, and check that they are breathing normally, and if so, place them in the recovery position. And you should always be prepared to resuscitate your casualty because of the risk to the airway. You should then assist the casualty to administer their own medication. This is usually in the form of an EpiPen, which is a dose of adrenaline. So I think at this point, people always ask the question about the use of EpiPens. Just want to cover the medicines legislation, which restricts the administration of injectable medicines. So unless self-administered, they say only to be administered by or in accordance with the instructions of a doctor, for example by a nurse. However, in the case of adrenaline, there's an exception to the restriction, which means in an emergency, a lay person is permitted to administer it by injection for the purpose of saving life. So the use of an EpiPen to treat anaphylactic shock is an example of such an exemption from the restriction imposed by this medicines legislation. So therefore, ourselves as first aiders may administer an EpiPen if they're dealing with a life-threatening emergency involving a casualty that has been prescribed and is in possession of an EpiPen and where the first aider is trained to use it.
Choking is a life-threatening situation and happens when the casualty's airway suddenly gets blocked so that they cannot breathe normally. Usually, choking in small children is caused by a small foreign object, whereas in adults it is most commonly food. If the blockage of the airway is mild, the casualty should be able to clear it by coughing. Any blockage of the airway should be taken very seriously, as within a short time of the brain being starved of oxygen, brain damage can occur. The recognition, signs and symptoms. Grasping of the throat, anxious and distressed, difficulty in speaking and breathing, persistent cough, pale grey-blue skin developing, becoming unconscious, Let's now look at the treatment.
Once you have established the casualty is in fact choking, your first action should be to calm and reassure the casualty and encourage them to cough. If this is not successful, then you should stand behind the casualty, lean them slightly forward, supporting their upper chest with either one hand or your arm across their chest, and give sharp back blows between their shoulder blades. These back blows should be attempted on 5 occasions. Check the mouth and remove any obstruction. If your back blows were unsuccessful, then you should attempt to give 5 abdominal thrusts. Again, stand behind the casualty and place both arms around them, leaning the casualty forward. Place one fist just below the breastbone and cup the fist with the other hand, as shown on the video. Then pull sharply inwards and upwards to try and force the obstruction out. Again, you should make 5 attempts with abdominal thrusts to remove the obstruction. If this is unsuccessful, you should repeat the cycle of back blows and abdominal thrusts, and if after 3 cycles the obstruction is not cleared, you should then call 999. If at any time the casualty becomes unresponsive and unconscious, you should support the casualty to the floor, call the emergency services as soon as possible, and commence basic life support.
So, in summary, encourage to cough up the obstruction first. Calm your casualty. Likely to become weak and lose consciousness within a few minutes. Make your movements sharp and firm. If not successful, with 3 cycles, dial 999.
With a choking baby, you should hold the baby in a similar position as a recovery position by supporting the baby with their head pointing downwards. As with an adult or child, you should first attempt 5 back blows. If this is not successful, turn the baby over and attempt 5 chest thrusts. If this is also unsuccessful, you should repeat the cycle of 5 back blows and 5 chest thrusts. And once again, if the object or obstruction has not become clear after 3 cycles, then call the emergency services.
Breathing is crucial to life. If breathing stops, then the casualty will die unless someone else breathes for them. It is important to understand the basics of respiration, as well as the causes of the problems that can occur, and how we can treat the casualty, therefore preserving their life. Taking a breath in is called inspiration, and breathing out is expiration. On average, an adult breathes between 10 and 20 times per minute. Children breathe quicker than adults, and babies can breathe up to 40 times per minute. On average, a man can hold 6 litres of air in his lungs, and a woman can hold 4. Of the air we breathe in, about 21% is oxygen, and the body uses about 25% of this. So we exhale around 16% oxygen, which is why we are able to breathe on behalf of our casualty if desired. Breathing is a natural process. The brain and our nervous system controls our breathing. Hence, we do not have to think about it every second, and how our breathing can change in certain panic situations or injuries. As we breathe in via our mouth or nose, the route into our body is known as the airway. We will show you how to open the airway and manage the airway to keep it open and clear of obstructions. If the airway is not clear, then the vital oxygen cannot get into our body. The action of opening an airway, if needed, may be enough to preserve a life, so it is a vital action for first aiders to follow. When we breathe in, the air passes the epiglottis, a small flap at the back of our throat to stop food or other objects from entering the windpipe, and down the windpipe known as the trachea, and results in the oxygen from the air passing through to the bloodstream for circulation and to the body's vital organs. It is this process that keeps us alive. As we breathe in, the diaphragm contracts and flattens, and the intercostal muscles between the ribs are elevated, increasing the chest cavity before then relaxing and taking their natural shape to help push the air back out as we exhale. If our breathing ceases, then the lack of oxygen to the brain could result in brain damage in a very short time. So it is vital to maintain an open airway and ensure the casualty is breathing normally. When a person with asthma comes into contact with something that irritates their airways, an asthma trigger, the muscles around the walls of the airways tighten so that the airways become narrower and the lining of the airways becomes inflamed and starts to swell. Sometimes sticky mucus or phlegm builds up, which can further narrow the airways. Common triggers include house dust mites, animal fur, pollen, tobacco smoke, cold air, and chest infections. The recognition, signs and symptoms: shortness of breath, coughing, difficulty breathing out, wheezing, distress and anxiety, difficulty in speaking, grey-blue skin tones, may become exhausted. Let's now look at the treatment.
Asthma is a very serious medical condition and immediate action is required. Firstly, help your casualty into a comfortable position and, if possible, a sitting position. This is leaning slightly forward, taking pressure off the chest wall. Then calm and reassure your casualty. The most important consideration with an asthma attack is to encourage the casualty to use their own prescribed medication. This is usually in the format of a reliever inhaler. The blue inhaler is the most common colour for the reliever medication. However, the casualty may have other medication and this may be in a different colour. The casualty is usually able to direct you with hand signals towards their inhaler because speaking will be difficult. If the reliever medication has no effect, or if the attack lasts more than 5 minutes, or in fact it is the casualty's first attack, then you should call 999 for an ambulance.
So, in summary, very distressing for all. You may feel very helpless. Sit your casualty up, leaning slightly forward. Use of their own medication, usually a reliever inhaler. Calm and reassure. With hyperventilation, due to your casualty breathing faster and or deeper than necessary, your body has too much oxygen. To use this oxygen, to extract it from your blood, your body needs a certain amount of carbon dioxide, CO2. It is commonly triggered by emotions of stress, anxiety, depression, fear, or anger. The recognition, signs and symptoms: rapid and shallow breathing, lightheaded or dizzy, anxiety, trembling or marked tingling in the hands and cramps in the hands and feet. Let's now look at the treatment.
If the cause is due to a panic attack or anxiety, then you should remove the casualty to a quiet place and away from the cause of the panic attack or anxious moment. You should calm and reassure your casualty, advising them to breathe at a slower rate, and it is recommended to do this by counting the rate they are breathing and then reducing that number. If this has no effect, then encourage the casualty to breathe into their cupped hands. This will help the casualty to rebreathe their expired air, which will help them increase their low levels of carbon dioxide in their breath.
So, in summary, reassure the casualty in a calm manner. Remove the cause. Care if using a paper bag, as this can create an adverse reaction. Ensure there is no underlying medical condition. Can sometimes be used for attention seeking. The circulatory system consists of the heart, the pump, and the blood vessels, which supply the body with blood containing vital oxygen and nutrients, and carries away waste products. Without a constant supply of oxygenated blood, the tissues and vital organs such as the brain and heart will fail. On average, an adult has a pulse rate of between 60 to 80 beats per minute. However, you should be aware that a very fit person, such as an athlete, will have a slower pulse. Babies and children have a faster pulse rate of up to 140 times per minute. A pulse should only be taken for monitoring purposes and not during the diagnosis. It can be taken wherever an artery is close to the surface of the skin. The most common locations are in the wrist, known as the radial pulse, or the neck, known as the carotid pulse, which is usually the strongest. The carotid pulse is the last to disappear when a casualty is in difficulty, as it is the main artery that feed the brain with oxygenated blood. The body can lose 1 pint of blood with little effect, hence the blood donor sessions you may attend. However, any more is lost, then this can lead to unconsciousness, a serious condition or medical shock, which is life-threatening. The heart is a hollow muscular pump, about the size of your fist, with 2 pairs of chambers. These chambers collect blood flowing back to the heart and then pump it out again. The heart beats constantly to pump approximately 6 litres of blood around the body every minute. The blood vessels, known as the arteries, veins and capillaries, carry the blood around the body and back again to the heart and lungs to be oxygenated and returned around the body again and again. It is possible to bleed to death in a very short period of time, depending on the location and size of the wound. Arteries, which deliver oxygenated blood from the heart to the body, have strong, flexible walls. Veins, which allow the blood to flow back to the heart. One-way valves keep the flow directed towards the heart. Capillaries are small, sometimes microscopic vessels, which form a link between the arteries, veins and body tissue, to allow the transfer of oxygen, nutrients to the body, and the waste products to be removed. Blood is made up of the following: plasma, the fluid component of the blood; platelets, help to block the blood flow by clotting; red cells, transport the oxygen via the hemoglobin; white cells, manufactures antibodies and fight infection and bacteria. Wounds are usually caused by cuts, tears or scrapes. A minor wound, such as an abrasion, scrape, means that there is only a minimal amount of bleeding and the wound is superficial. Mild bleeding can always be stopped within 15 minutes by direct pressure to the wound. A major wound has severe bleeding involved, possibly an embedded object, or deep destruction of the tissue. Apart from the blood loss, you should also be managing the risk of infection, which can be caused by germs or cross-infection with you. In addition, due to the loss, then oxygenated blood may not effectively reach your vital organs and cause the condition of medical shock. The recognition, signs and symptoms: blood loss, distress, a laceration, incised, contusion, abrasion, puncture or velocity wound, signs of medical shock. Let's now look at the treatment.
When managing a bleed, you should always wear your disposable gloves. Your emphasis should be on controlling the bleeding and treating for medical shock. Firstly, examine the injury and check for any embedded foreign objects. Do not remove any embedded objects, and we will later show you how to treat this situation. Ensure that you elevate the injured part if injuries allow to reduce the blood pressure and flow of blood. You should then apply direct pressure to the wound to control the blood loss. If they are able, you can ask the casualty to assist with this pressure, especially if someone is getting the first aid box for you and you do not yet have your gloves. If injuries allow, look to lay the casualty down to help prevent medical shock. Then from your first aid box, take and apply a sterile dressing of the appropriate size. When applying the dressing, place the sterile pad over the wound, and as you wrap the dressing, ensure that you maintain a pressure and the dressing wraps around the area to cover each end of the sterile pad. If bleeding seeps through this dressing, then add a second dressing over the top. However, if bleeding continues to appear through both dressings, you should look to remove all dressings and start the treatment again. Once the bleed is controlled, you should support the injured part and, where applicable, apply an elevated arm sling. To apply this type of sling, firstly raise the casualty's fingertips of the injured arm to the opposite shoulder. Then place the triangular bandage over the raised arm with the short point at the elbow. With your hand, look to chop under the forearm and elbow to create a pocket for the arm to sit in. Secure the bandage by tying the ends with a reef knot behind the casualty, and then secure at the elbow with a safety pin or by simply twisting the fabric and tucking it in. The treatment for a bleed that includes an embedded object follows the same principles as the treatment for major bleeding. However, you obviously have to take more care when applying pressure. Do not attempt to remove the embedded object, as this is likely to be controlling the blood loss, acting like a plug. As shown, apply pressure on either side of the object using relevant sized dressings. Do not apply any direct pressure on top of the object. Then dress the wound, as before, using a sterile dressing, but wrapping over the dressings used around the object.
So, in summary,